This is Gary Stonker. This medical laboratory science video will answer 8 frequently asked questions that are unique to medical laboratory science careers. This video is for college students with majors in biology or chemistry or microbiology. It's also a good resource for high school students thinking about their college majors and degrees. Medical laboratory science is known as the hidden profession. Yet the work done in those medical laboratories provides doctors and nurses and their patients with about 70% of the information needed for diagnosis and treatment. I have worked in a medical laboratory for more than 20 years, so I'll be able to provide you with some career guidance on that medical laboratory career. This will include giving you things you can do with your Bachelor of Science in Biology or Chemistry or Microbiology. In addition to this video, there are many more videos coming about medical laboratory careers, including interviews with those who've chosen that career. Make sure to click on the subscribe button down below and that little bell as well to get notifications of when those new videos are posted. You don't want to miss anything. Laboratory managers and talent acquisition professionals, recruiters, around the country regularly share their concerns about the challenges in finding trained medical laboratory professionals. Stay with me for a few minutes, and I'll share with you those 8 frequently asked questions about what the career is and what you need to do to be able to consider that career for yourself. The first question is, what is the pay of a medical laboratory scientist? And it really varies by region, but I owe you some ballpark ranges. And for the associate's degree, something called medical laboratory technology, you're looking at $45,000 to maybe $50,000 a year. For that bachelor's degree, that medical laboratory scientist degree from an accredited college university, you're looking at $55,000 to $65,000 per year. A couple of things to consider. There is the ability to negotiate higher wages. If you would like, go ahead and subscribe to the email list below and I'll make sure you get those updates. But it's also a function of urban versus rural. Urban rates tend to be higher than rural rates. And also don't forget that working in the medical laboratory offers you the opportunity to work different shifts because it's open 24 hours a day. When you work the typical evening shift, a night shift, overnights, you can earn somewhere in the vicinity of $10,000 or a year more with that shift differential. What are the hours you would work in a medical laboratory? And again, I'll remind you, it's a 24-hour-a-day operation. You can work the day shift early in the morning till mid-afternoon. You can work the evening shift mid-afternoon to late evening, and the night shift, overnight hours, 11 p.m. to 7 a.m., something like that. It's important to note, though, that many labs are adjusting that flexibility. And I have noticed that, especially on the night shift, that there are laboratories that will offer you something like a 12-hour shift that you'll just work 3 nights per week. So work 3 nights, have 4 nights off. So be aware of that as well. Do you touch body fluids? Yes. Always with the proper protection. Gloves, masks always. There's typically a hood that you can work under, but you'll be touching blood specimens, urine specimens, fecal matter, body tissues, organs on occasion, but always with proper protection. The typical follow-up question to body fluids is always, does it smell? No, not really. And in those situations when aroma is present, you always have the opportunity to work under a hood, and a hood essentially sucks up all of the air behind a glass partition to keep your nose and other parts of your senses immune from those bad odors and smells. The next regularly asked question is, are laboratories really in basements? Let's call that an urban myth. And so the answer is no, not really. Yes, there are laboratories in basements. In large part, that's because it's not a patient-focused physical space. But more importantly than that, it's a function of being able to have access to plumbing, because there's a lot of fluids, both inbound and outbound in laboratories, and sometimes it's just easier to put that on lower levels. The next question is, why is there a shortage? Well, I'm assuming that you know there is both a chronic and acute shortage of medical laboratory talent throughout most of the country. The best explanation is that this is indeed a hidden profession. Even though 70%, give or take, of most hospital diagnosis, therapies, treatments are based on laboratory results, very few know what is required to do the job. The education needed, the experience needed, the compensation, all those things. That's really why I provide these kind of promotional career videos. But it's important to note, even though it's a hidden profession, it still offers meaningful work. You'll see career growth opportunities and above average compensation. If you're thinking about this career, I encourage you to drop your comments down below, subscribe to the channel, and if you'd like to keep regular updates from me on more opportunities in medical laboratories, make sure you join the email list, also in the description down below. So how do you get started in a medical laboratory career? Let's look at it from two options. The first is for those of you listening and watching this video who are high school students. You'll want to look at what's called a 3+1 college degree program. There are some Bachelor of Science and Medical Laboratory Science programs located in states throughout the country. I've put a link to those programs in the description section below. You're looking at 3 years of work on a college campus of your choice that has the Medical Laboratory Science bachelor's degree program, and completing a 12-month internship, sometimes or less, at an accredited hospital laboratory in many cities throughout the country. The second option is those of you in your junior or senior years of college, maybe your sophomore year, who are majoring with a Bachelor of Science in biology or chemistry, microbiology, maybe public health, and are looking at that first post-degree job opportunity. For you, there are programs called 4+1. You've got the Bachelor of Science in one of those disciplines. The next step is to plug into a college and hospital system that can get you those final requirements to get that Bachelor of Science in Medical Laboratory Science. Again, I would encourage you to subscribe down below to make sure you see these videos and get the links I share in the description that can connect you to colleges and hospital programs to get that laboratory degree. So what are your career options in the medical laboratory? And while I'll go into details in another video, here's a list of possible career paths you could take. A laboratory generalist that works in all the departments in the laboratory, in chemistry, microbiology, blood bank, hematology, and others. A clinical specialist, someone typically in a larger hospital laboratory who focuses and specializes in just one of those disciplines, microbiology, chemistry, blood bank, and on. Quality assurance. One of the unknown features of medical laboratory science is the work that goes into making sure the results are accurate and precise. You can specialize in that kind of work. You can become a clinical supervisor. Again, becoming skilled with both the management and clinical skills required in a specific discipline. In time, you could grow into a role as a laboratory manager or director, overseeing the business, personnel relations, and other operations of a clinical laboratory. You could look at becoming a laboratory IT specialist, where you specialize in managing the data associated with clinical laboratory results. And finally, you can even get outside the laboratory as a vendor rep into sales and marketing, service support, maintenance on equipment, all sorts of items exist. So a career in medical laboratory science doesn't commit you to a lifelong, career-long path just inside a clinical laboratory doing test results. There are many, many, many other career options to provide you with a fascinating and exciting career. If you have other questions that I didn't cover in today's frequently asked questions about a career in the medical laboratory, make sure to ask your questions and even make your comments in the section below. I'll be sure to respond promptly.